We are at the Tulsa Health Department tonight, and we want to bring in an epidemiologist, Nicole Schlafly, and talk a little bit about what's been going on. Obviously, we have the second healthcare worker, and that probably just makes all healthcare workers across the country, I would think, a little anxious and just a little nervous about what's going on with our healthcare system.
Right, it does. We do want everybody to realize at this point that the Tulsa City County Health Department has plans and partnerships and lots of protocols in place, and we are very confident in our response that we're going to give to Ebola if it happens to come to the county.
And I guess the main thing is just communication with the hospitals, the clinics, and all those kinds of things.
Exactly. Communication is very vital at this point.
All right, we're going to continue to follow that. Nicole, thank you so much for joining us today. You know, obviously, healthcare workers are a little bit anxious about all this, and hospitals across our viewing area are doing everything they can to ramp up and be ready for whatever comes their way. We found one hospital down in Muskogee. They say they're ready and prepared. Becky Elliott is an infection disease preventionist at eStar Health System in Muskogee. She'll tell you Ebola has healthcare workers on edge.
You know, I don't want to say you ever feel comfortable. I do feel better in the fact that CDC now said that they will send a team in to assist us. That's good.
But eStar has a plan in place and they're ready to go. They emailed it to all employees today. They showed us their decontamination center loaded with protective gear. Muskogee EMS says they too are prepared, not only with equipment, but also arming employees with information.
Mainly the thing that we're seeing is giving the employees the information to reduce the stress that they're feeling. They're getting a lot of information from a lot of different places, and so we wanted to have a defined amount of information coming from one source, the CDC.
The biggest concerns are the upcoming flu season and TB. Both can mimic Ebola symptoms. So hospital staff know they will be tested in the coming weeks and months ahead, but health experts here say they're going to stay on top of it and keep the lines of communication open.
We have to keep a consistent, credible source of information to our staff that they can then share with their family and the community.
And the health experts at eStar tell us they've been slowly accumulating hazmat gear ever since it went in short supply due to SARS. They say they now have plenty on hand should an Ebola patient come through their doors.